Hello midwifery students, today I'm going to show you guys how to do a one-handed tie. So when you're doing a repair in the vagina, it's kind of a small space and you can't use both hands to do your tie. So what you actually have to do is use one hand to do most of your tying, and the other hand you're just going to hold that side just kind of steady. The whole time you're doing this, you want to hold tension on both of them by holding a little bit of tension between your index finger and your thumb. So you hold a little tension on your tie. So the first maneuver we're going to do is what I call the karate chop. So you're going to hold on to your suture, you're going to come on top of it, and you're just going to chop it and turn it over, flip it over. So imagine that you were just karate chopping it. So you just, there you go, you just turn it over like that. And then you bring the other side across. So both of them are running across your hands. One's going from the bottom up, the other one's coming from the top. Then you use your middle finger, you bend it down, and then you grab that orange suture, and you're gonna hold it between your middle finger and your ring finger. You just kind of hold it there and you pull it through the hole. And that's your first, and you push it up. So you're gonna wanna perfect one side. You're going to want to practice that until you get it really good, and then we'll go to the second one. The second tie is you're going to make kind of a V between your index and your thumb. Do you kind of see that V right there? And you're going to push it across the other one, your post, and you're going to make a 4. So you see the 4? Perfect. So once you have your 4, you're going to put your index finger down into the hole. You're going to go under that blue, and you're going to grab the orange, and then you're going to just flick it up through the top. So we're going to try that again. So you're going to grab it and make a 4 across your post. There you go. You're going to go into that hole. Make sure when you grab it on the other side that you hold a little bit of tension on the orange. You go through with your index finger, go on top of it, and then you just flick it up through the hole, and then you pull it tight. So when you're doing these ties, you have to go back and forth between both of the ties. So you start with the same one all the time, and I always start with the karate chop one. So I go across, yep, bring the blue across, middle finger over, hold it between your middle, and then you pull it through. So that's your first throw. Then you do your second throw, which is the 4. So you make your 4, you go with your index finger, you pull it, flick it up, there you go. And then that's a square knot, but you still have to do one more. So you always want to do 3 throws to make sure your knot is really secure. So once you've done the 3, when you're doing your repairs, that's how you do it. If you were first assisting and you're on the fascia, you'd have to put 6 throws in. But for these purposes, when you're doing a vaginal repair, you do 3 throws. So my advice is to do about 50 of the first throw until you have it really, really, you're really comfortable with it. So just keep doing that one over and over and over until you have it down. So, yep, you go over the blue, you grab it between those 2 fingers and you pull it. I would like to give my daughter credit for being a good hand model. Okay, good. And now let's do the other one. So once you have that one down, you've done it about 50 times, okay? You want to do the second one. Make your 4. If you hold a little bit of tension between your thumb and your middle finger, it helps you to flick that up. There you go. Just for practicing, you want to, just while you're practicing, you want to do 1 so you get it really secure. Put your finger down in the hole. There you go. Perfect. And then once you feel like you're really secure, then you just go back and forth. And when you're sitting and watching TV or you're just hanging out, just get some yarn, tie it to something, and practice going back and forth. That way when you're in your clinical site, when you finally get a clinical site and you're ready to do your first repair, your preceptor will be super impressed. Go back to the other one. Yeah, every other one. your preceptor will be super impressed with your ability to tie your knots, and you'll feel confident. Once you get comfortable doing it with yarn, put some gloves on, get them good and sticky, and try it with some suture, because that's actually what you'll have to be doing. Okay, I hope that this has been helpful for you, and have somebody else watch what you're doing to see if you're making mistakes or you're struggling, to kind of tell you what you can do to improve your technique. Okay, thanks.